later. Great. My name is Sharice Lyles, and I'm part of the facilitation team for this session, along with my colleague, Audrey Everett. If you have any trouble, technology trouble, please reach out to her in the chat so that she can remedy that for you. Just a few reminders that at the bottom of your Zoom screen, you will see the Zoom navigation panel, which will be helpful for your engagement. And then as we go to the next slide, for that engagement, we do welcome you to turn on your camera, as it makes us feel like we're all in a room together, sharing and learning together. If you're not speaking, please keep yourself on mute, and that mute button you can find in the panel. And then finally, please ask questions or share your reactions in the chat box. And you don't have to hold it till the end. If you have a question, just please put it in there. We have colleagues who are tracking those questions that we'll bring up in particular during the Q&A session. And as we come back to our slides, great, thank you. We would like to turn it over to Mira Shekar, Global Nutrition Lead for the World Bank, to offer our opening address.
Thank you, Sharice. Thank you for getting us started this morning. Actually, this is the second session of the Nutrition Financing Week this morning. So I hope everyone is enjoying the really, really excellent sessions that have been presented. We just finished a session on fiscal policies for nutrition. And if you missed it, I do want to say, or if you missed any of the sessions the day before, they will all be available to everybody over time. So today's session is really focused on Optima Nutrition. You've all heard me say multiple times, we need more money for nutrition, but we also need more nutrition for the money that is being spent. And as Jonathan and colleagues from Pakistan, from Nigeria, and Tajikistan will share with you later today, this morning, there is a tool called Optima Nutrition that has the ability to get us more nutrition for the money that is being allocated. Let's go to the next slide, please, Sharice. So those of you who remember the global investment framework that we developed in 2017 that looked at the nutrition targets under the SDGs, the big question we were asked at that point was, how much will it cost to get there and to the targets? And we did try and address that question with an estimate of about $7 billion a year that were needed to get there. And then the next question that was being asked was, what will we buy with these investments? What will we get in terms of nutrition outcomes, in terms of lives saved, health benefits, economic benefits, and so on and so forth. And then, of course, the big question on how can it be financed? And I think some of these questions were answered in that framework. Let's click the next thing. But the big question, next slide, please. The big question that we were not able to answer, yes, thank you, which was, if we got all that money that we are looking for, how can we allocate those resources optimally so that we can get the best outcomes for the available money? We all know that money is always limited. We need more, but we can never get as much as is needed. So how do we allocate it across the various interventions that need the resources? That is a question that we were not able to answer at that time. Let's get to the next slide, please. So that was really the birth of Optima Nutrition. We learned, as Jonathan will tell you in a little bit, we learned primarily from Optima HIV, which was an existing tool. we built on that to try and answer this question about if we had resources available, how would we allocate those across the various interventions that we've known to be effective? And so with the, and I just a reminder, and some people have asked this question in the past, that it's not a magic bullet. It's not a one size fits all. This tool needs to be applied in the country context. Every country had different epidemiology, different fiscal situations, different implementation modalities, and all of those things can be addressed through the tool, so that what you come up with will be customized to that specific country context. Next slide, please. So today's session, a very exciting session. Jonathan Kreku will walk us through the tool itself. And then we will hear from three of our country colleagues, Ritka Kasabe from Nigeria, Mutriba Latiopa from Tajikistan, and then Alia Kashif from Pakistan, about how they applied the tool in Nigeria, and Tajikistan, and Pakistan, and what lessons were learned. And then we will have a panel discussion with each of these presenters. And a reminder again, please put your questions in the chat box so that we can try and have the panel discuss those questions. And then we will end with next steps and the way forward. So with that, can we go to the next slide, please, Cherise? Yes, a reminder, yes, please do put your question on the chat. And yes, let's go on.
Great. Thank you very much, Mira, for that framing. Okay, next we'll go to an overview of Optima Nutrition with Jonathan Akuoku, who will be providing that presentation for us.
Thank you, Cherise. Thank you, Mira, for that introduction and setting the framework for the discussion on Optima today. Good day to everyone. So we've heard from what Mira has said about why the tool was developed. And so this presentation, I will present very briefly on how it can be used, how it works, and what it takes to actually go through the process of conducting an Optima Nutrition analysis. Next slide. So the Optima Nutrition model can be used to assess the impact of intervention scenarios and to identify the different packages of interventions that will achieve the greatest impact for a given objective. So if a country's strategy is to reduce stunting or wasting, and within a certain resource envelope, how best can that resource be allocated to different interventions to achieve those objectives? And this can include analyses to understand which geographic areas or affected populations to target and the minimum resources needed to achieve nutrition targets. The results in turn can be used to inform realistic prioritization within broad national strategies and plans for nutrition, the design of new investments, with support of the World Bank, with the support of other development partners, and through the country's own domestic resources, and the reallocations within existing programs in order to achieve a greater impact. Next slide. So just very briefly, as a broad overview of how the tool works. So the impact model for Optima Nutrition is a reproduction of the LiveSafe tool, for those of you who are familiar with that modeling. And the LiveSafe tool is a modeling tool that estimates the impact of scaling up and scaling down different sets of maternal, child health and nutrition interventions, and seeing what kinds of impact can be achieved. The evidence for the impact of interventions are derived from meta-analyses and systematic reviews, which have been rigorously examined of randomized controlled efficacy and effectiveness studies. And these are the same interventions that are included in WHO guidelines and have been identified as effective interventions in the Lancet series on child and maternal malnutrition from 2008 and with the latest revision in 2019. The main components of an application are to understand the burden of malnutrition in the particular context that you're interested in, the possible programmatic responses, the objectives and constraints for the given setting and a policy objective, and then performing the optimization. So understanding what is the burden of malnutrition, and this involves data synthesis from a number of sources, including DHS data sets and reports, population projections, information from bureaus of statistics and other government agencies. And then the model can project a baseline scenario of what could happen if nothing was done or the current allocation of interventions are maintained. The model then applies the range of possible interventions and delivery modes that are available in the context, and these need to be identified, including their costs and their potential effects. And then it's important to understand what the objectives of the analysis are and whether or not there are certain constraints. And this involves working with partners, government, donors, other stakeholders to understand the strategic goals of the country and then agree on how those goals will be operationalized for the analysis, but particularly looking at whether or not looking at using the analysis to achieve the national nutrition targets. And this often includes also consideration of ethical, logistic, and economic constraints. It's important to ensure that the model is relevant by considering a subset of interventions that are likely and feasible within the context, and also within potential constraints of implementation, political considerations, and ethical considerations of what might be feasible to scale down or to scale up. Next slide, please. So here is a diagram of illustrating how the main risk factors are connected to one another in the model and how they can impact on stunting and mortality. So for example, in this case, if you look at the bottom on breastfeeding practices, in the model, breastfeeding practices, if they're improved perhaps through better education, can directly impact on mortality, as well as indirectly reduce mortality because it improves breastfeeding practices, because improved breastfeeding practices reduce diarrhea incidence, which also lowers the risk of stunting and which in turn reduces the risk for mortality. Next click. Interventions in the model are implemented so that each targets at least one or more risk factors and or mortality cause. So for example, balanced energy protein supplementation, the top one, and multiple micronutrient supplementations for pregnant women improve birth outcomes, which have an impact on stunting and also neonatal mortality. Other interventions impact directly on stunting or mortality or indirectly through other risk factors. For example, for prophylactic zinc and vitamin A supplementation impact on diarrhea incidence, which then also has an effect on stunting and mortality. Next slide. Now, just to illustrate how in the background the model actually functions. So consider a scenario where you're looking at two interventions. Let's say you're considering you have a budget to fund two nutrition programs, let's say IYCF and multiple micronutrient supplements for pregnant women. And the objective is to reduce the number of stunted children. So on the z-axis, so the arrow pointing straight out, is funding for one program. On the x-axis, the arrow pointing to the right is the funding for another program. And the arrow pointing straight up is then the resulting impact of funding, the different funding that can be allocated to the different programs. So the program will first create hundreds to thousands of scenarios. Please click through. Okay. Go ahead, yeah, go all the way. it will create hundreds of thousands of scenarios in which different amounts are allocated to each intervention. So each of these bars indicates an amount allocated to one program, and so say IYCF, and then the amount allocated to micronutrient supplementation. Once this is done, it then searches through all these different iterations to identify very quickly, and this is where the optimization algorithm comes in, which set of allocations produce the greatest impact in reducing the number of stunted children for the least amount of money. I'm using stunting to illustrate the model, but the model can also address outcomes such as wasting, anemia, infant and maternal mortality as well. Next slide. So this is the model that's fairly data intensive. And some of this data can come from, much of the data can come from secondary sources. And depending on what's available on the ground in terms of intervention costs and coverage, some primary data collection might be needed. For an application of the Optima Nutrition model, you need context-specific data on the nutrition and health status of the population of interest, the demographic projections for the period of analysis. So if you're doing analysis over 5 years, you do need how population changes and the target groups for the interventions changes over that period, the available interventions and their coverage, and the unit cost of these interventions. And all of this data is imported into the model through an Excel-based template. And again, these can be obtained from common sources such as DHS, MIX, and other population representative surveys, and are important for calibrating to the baseline characteristics of the setting being modeled. Next slide. So you've heard very quickly and very briefly on a little bit about why the model was developed, what it can be used for, how it works, and the data needs, the data needs to conduct analysis. And perhaps you're now interested in undertaking this work in your context. So what does it take? So this is sort of a general description of the process of conducting an analysis, and this can vary from context to context. Some things, there's a lot of going back and forth with partners, but this provides a sense of the process of going through this modeling. So a successful implementation involves starting with the sensitization of key stakeholders who can influence not only the process of the analysis, but most importantly, the application of these results for decision-making. And depending on the structure of the nutrition governance within the context, this can involve government at multiple levels, development partners, academia, et cetera, and stakeholders who would be key to for advancing and using the analysis. This sensitization also provides an opportunity to engage institutions that may provide guidance and oversight for the analysis, or to identify key individuals and groups to form a technical or expert working group. So the next step, and this group would structure and guide the analysis through dissemination and advocacy. So depending on the availability of data, some additional primary data collection may be required, especially for estimating unit costs and coverage of interventions. And this can involve both local and international consultants, as well as staff from relevant agencies within the government. And this largely depends on available capacity and the resources to support this work.
Pardon me,
the next step,
we have about 30 more seconds before the poll.
Okay, so the validation and analysis process involves extensive consultations with the technical working group, and then the analytic report is finalized based on their guidance and feedback. It's important that dissemination is planned to take advantage of key budgeting and planning cycles and engage various stakeholders and forums. And so in the following presentations, we'll hear briefly about country experiences along the stages of this process. But before going to the country presentations, we'll first like to get a sense of what you want to know about regarding the tool. You should see a poll question pop up. and indicate which areas you'd be interested in exploring further. So we'll give you a little bit of time to make your choices. A lot of interest in the costing. Okay, it's changing. It's very dynamic. Okay. Good. We're getting quite a bit of responses. So maybe I think we've gotten a significant number of respondents. So I'll share some of the results. So what it looks like, there's a lot of interest across the board, but especially in the costing analysis process, the interventions in the model, and also the data needs. And those actually are fairly significant parts of doing this. And the other part is stakeholder engagement, and Nigeria will present on that, and that's actually a very critical part of the process as well. So we'll be pleased to hear from Nigeria on their experience. So we'll cover some of these areas, and of course we invite you to follow up, particularly if you're planning to do this work in your context to get further guidance. So with that, for the first presentation, I welcome Ritka Kasabe, a Senior Health Specialist from the World Bank Nigeria office, to present on their experience with stakeholder engagement throughout the process. Over to you, Ritka.
Thank you, Jonathan, for that background. And good morning, good afternoon, good evening, colleagues. Like Jonathan mentioned, I will be speaking about our experience engaging stakeholders with Optima analyses in Nigeria. First, I'd like to start by describing what we envisaged as stakeholder engagement, and then secondly, walk us briefly through the process that we undertook. So when the engagement on Optima started, we had envisioned a process that could really bring together a focused but diverse cohort of stakeholders who we felt would be directly affected by the nutrition plan. At the time, the National Strategic Plan of Action for Nutrition was going to be revised and had lapsed. And so we looked for stakeholders who analyzed based on stakeholders who were directly affected or could significantly influence the outcomes of the plan in one way or another, to participate in the process of generating, collating, and applying the evidence to the plan, to the development of the plan. And really what we sought to see was to come out with an evidence-based plan that was realistic and implementable, given our current context. Already prior to the pandemic, Nigeria was already facing some macro-fiscal challenges. And so we knew that we'd be operating within a very fiscally constrained environment. Also, this is against the backdrop of the first plan having been developed and implemented, but yet stunting rates persisting and have persisted over the last 2 decades. We also have seen only marginal declines in wasting and anemia. And so in the process of engaging stakeholders, we started initially with the Federal Ministry of Health in country, which is leading or was leading at the time the National Strategic Plan of Action. The bank team here was locally, first of all, familiarized with Optima Nutrition and what it could do. Some of the information and what Jonathan had shared in the previous presentation. And for us to look at the range of outcomes and start to think about the agenda along with the government. The nutrition division was eager to and accepted to collaborate on using the tool to create an evidence base for revision of the end span. We did have to then engage in the process of collecting additional data, so we collated from secondary sources and generated the data books that were used for the analyses. An expert working group was then formed. And here, this is where we sought a very broad range of participation to ensure that there was continuous sort of buy-in engagement with the analyses, and that there would be this sort of collective ownership as we drove towards implementing the plan and engendering accountability for results. And so we had federal MDAs spanning about 15 different MDAs, of which a cohort were selected. This includes within the health sector, the ministry itself and some of its departments and agencies for planning, research and statistics, primary healthcare, as well as agencies outside of the health sector. So the Ministry of Budget and National Planning, who coordinate nutrition actions in country, agriculture, education, and other colleagues for whom these outcomes would be a priority. There was also strong representation from the development partner community. So a lot of the key funders and actors in the nutrition space were engaged. We also had civil society representing the voice of the people, and academia and research organizations all represented on the expert working group. And like Jonathan described, this group really engaged iteratively with the analyses and with the data and with the outcomes to shape eventually what became the evidence that was used to articulate the plans. We did have a small lag during the COVID pandemic, and there met a change in leadership, transition on the side of government. And so there was a process of re-engaging with new leadership and bringing them up to speed in terms of familiarizing and orienting them on the possibilities and the range of analyses that could be done with the tool and how this would inform the policy process. Following which we trained and created a cohort of officers, technical officers, who would then facilitate and conduct the analyses.
Pardon me, Rebecca, we have about 30 more seconds.
Sure. As this process was ongoing, we then saw a major shift in the nutrition agenda, because at the time the government then ratified a multi-sectoral plan of action for nutrition, and this meant that our priorities had to shift. And so we found ourselves operating from a more deductive position, because the plan had then been already ratified. And here we again had a re-engagement with the same stakeholders, but this time to look at the plan and optimize the current plan with a view to articulate very specifically what the current financing needs were. The outcome of that was that because we are in a federal state, a federal and subnational, we're starting to then see an increased appetite from state level stakeholders for this sort of process to be repeated iteratively on an annual basis to inform nutrition budgets and the multi-sectoral plans that are currently being developed from the national plan. So I will stop here. We will have a chance, I believe, to speak about the lessons learned and to be able to sort of distinguish between the different experiences that we had with the various stakeholder groups. Thank you.
Wonderful. Thank you, Rebecca. We look forward to that in the panel. Just a reminder to please put your questions in the chat as we go along. And next we invite Mutriba Latipova, a health specialist from the World Bank in Tajikistan, to offer country experience with data collection, collation, analysis, and validation. Mutriba, you are welcome.
Good day, colleagues. Greetings from Tajikistan. It's a pleasure and honor for me to represent the team that worked on Optima Nutrition analysis in Tajikistan and share our country experience in terms of data collection, collation, analysis, and validation. First of all, want to thank for technical assistance and support Burnett Institute as well as Jonathan, because and then Nutrition Global Solutions Group of the World Bank for guiding and leading us during that process. Let me start with rationale for Tajikistan. Tajikistan is a landlocked country. It's been experiencing huge issues with undernutrition, and there is also double burden of nutrition in Tajikistan. Almost 18% of children is stunted, and the country have been just realizing that it needs to work on its nutrition sort of outcomes. And Tajikistan joined Sun movement in 2013, and since then, really, a nutrition agenda was at the center of and a sort of at a high level of agenda in the country, and there is a political will to improve nutrition outcomes. So December 2018, next slide please, December 2018, the World Bank synthesized the government and presented the idea of conducting Optima Nutrition in Tajikistan. The government have offered to conduct a stakeholder sort of consultation and present Optima Nutrition, which happened in January. Very much this process in Tajikistan is similar to Nigeria, as well as very sort of perfectly fits the way that Jonathan described the process, because all these elements were involved. And for us, it have taken about 1 year, 2 months to complete the process, which we hit then by COVID, and we wanted to do more, but I think now we will maybe reinvigorate the work on Optima Nutrition. But we have completed the process. The results have been produced and shared with the government. For us, very important to advance nutrition, because children born in Tajikistan is reaching only 50% of their potential needs, and nutrition is at the sort of core of these investments, because by improving nutrition, we can improve actually health, access to health services, and the children's sort of nutrition outcomes for children, and for them to reach their maximum potential. So next slide, please. So in terms of data collection, collation, and analysis and validation, you can see that the different types of, so it was first of all secondary data, and the types of data that has to be collected. You can see then the data sources we used were mixed, DHS, National Nutrition Survey, Annual National Statistics, UNICEF website, there's online sources, and other Ministry of Health reports. For example, report form number 5/32/12, which provides data on maternal and child health. We tapped into various other sources like Department of Pharmacy and Medical Products, MOHSP, and other reports produced by the development partners, and then data collection process. So first of all, we collected national level data. Then there is, as you know, Optima Nutrition tool has Excel file, which the data is inserted there. Then the data is actually run by, you insert all this data into the Optima Nutrition analysis tool, and you ask different questions and run the analysis, and then you produce. So first sort of stage was to analyze national level data, and then a second as a subnational level data, regional data was analyzed with asking different questions. For us, the questions were, what if we don't do anything? How we can optimize the current level of funding, and what if we increase the budget for nutrition in Tajikistan? Then cost calculation methodology. For us, it was quite complicated because this data is not on the surface. We had to actually be very creative about it, adapt the methodology into Tajikistan's condition of availability of data. For example, we needed expertise from food fortification experts. We needed, inputs from the WHO colleagues, from UNICEF colleagues, in order to correctly calculate the cost of nutrition intervention per person, which is not absolutely available in the country.
Pardon me, Mutri, but we have about 30 more seconds.
Sure. Next slide, please. So some of the lessons learned, maybe I will highlight here. So I want to emphasize it's very important to have the right selection of data collectors. High level engagement would be needed to maybe ease in the process of data collection, because all of the stakeholders were there was buy-in, they were making their data available. Also, I guess ongoing technical support from Optima Nutrition tool developers was important, and efficiency and optimization are not part of the usual vocabulary in the health sector. So it was important to engage stakeholders, explain them that what this or that term means, how this or that intervention could be done, because some of the interventions does not exist in Tajikistan. So we had to be very, very creative. And I guess the rest we will discuss perhaps during the discussion, and I'll share more lessons learned and challenges on Tajikistan. Thank you so much.
Wonderful. And again, we look forward to your contributions in the upcoming panel. Thank you, Mutreba. Now we will move forward to the experience with analysis at the subnational level. And for that, we will have Aliyah Kashif, Senior Health Specialist at the World Bank.
Thank you, Cherise. And I'd like to begin by saying thank you for the opportunity, and would like to thank the team. I'm glad to see Mira there, because she was involved at the federal level when we were developing the Sehat Sahulat program, and she reflected on the Optima results at the federal level during that meeting. Before we set out for the presentation, I would like to set up the context, because we have to remember that bank in Pakistan has been engaged in the nutrition space for the last decade or more. And this is prior to devolution as well as after devolution. Health has always been a devolved subject. So nutrition level programming, health level programming has always been done at the provincial level. The bank was engaged in developing sectoral programs for all the 4 provinces, including Sindh, Punjab, Balochistan, and KPK. And these were basically learning from the Lancet series 2008 and the recommendations of it. And as we moved along in that nutrition space, and there were some transformative outcomes that we did learn. For example, for the non-LHW covered areas, we had contracting out to NGOs for delivering nutrition specific services. And on the way, in parallel, there were a lot of other pieces that were being done. For example, the provincial level nutrition policy guidance notes were developed along with the development partners. Bank was convening the Nutrition Development Partner Forum. And after the nutrition policy guidance notes, we went on to develop the intersectoral nutrition strategies and hence the multi-sectoral programs. And in 2013, Pakistan joined the SUN platform. Sindh has been a pioneer in all of these because we had a champion in Sindh, and we had a champion from the Planning and Development Department who was the secretary at that point in time. And the reason that we were able to do all of these things in Sindh was because of that nutrition champion that we had in Sindh. If you could move on to the next slide, please. So we did a federal level Optima training in February of 2019, and then we moved on the request of the government of Sindh, because the secretary at that point in time wanted a Sindh specific analysis. And because we were implementing a multi-sectoral nutrition program in Sindh by the name of Sindh Enhancing Response to Reduce Stunting, the Secretary of Planning and Development was very, very involved and engaged in that process. And she helped us constitute a technical working group, which was chaired by the Secretary P&D, and the composition of that group had basically all the different technical agencies like UNICEF, WHO, partners like European Union, Micronutrient Initiative, Food Fortification Program, UNFPA, and then we have representation from the Bureau of Statistics, Sindh. We had representation from the Department of Health. We had our previous program implementation unit for the sectoral program, as well as our PIU for the multi-sectoral program. We had representation from the Agri Department, Livestock, Fisheries, and WASH. and we had a couple of INGOs there as well. And this technical working group is still functional. The project came to a closure as of December 30th, 2021, but the technical working group is still there. So bank facilitated this Optima Nutrition workshop in July of 2019, and we had representation from all the relevant stakeholders in this. Next, please, Cherise.
And pardon me, Leah, we have about a minute and a half left.
Okay, I'll rush through. So with this detailed Optima analysis that was conducted, we basically picked up data from the 29 districts of Sindh, and Jonathan and David were a part of that exercise. And you could move on to the next slide, please. So the analysis within each district basically looked at how we could divert funds from existing specialized nutritionist food for children and PLWs to ORS and zinc, and how to use these funds to expand vitamin A supplementation and IYCF with a coverage of more than 90%. There are 2 districts in Sindh called Thatta Sajawal, where, through this allocative efficiency tool, we found out that the funding is the greatest. And if we invest in a combination of, let's say, treatment of MAM, cash transfers, and ORS and zinc for children, we could get maximum results out from there. Could you move on, please? So basically, even though that this Optima analysis was presented to the government of Sindh Planning and Development Department and the development partners, during our midterm review for the project, we presented the findings of this Optima analysis, and the government of Sindh is very, very keen in the interests, in the results of the Optima analysis. But however, due to the COVID situation over the last 2 years, there have been no new policies or strategic frameworks for nutrition that have come up for the government of Sindh. So for now, even though their accelerated action plan for reducing stunting, which the bank was supporting, has to be revised, but we yet have to see whether the results of the Optima analysis would be incorporated into that or not. Can you please move forward? But we have, at the programmatic level, at the Department of Health level, we have seen some programmatic shifts, and it's not that these interventions were not previously a part of the nutrition specific package that the Department of Health was implementing. However, because of this particular exercise, this exercise of Optima analysis and the training that was conducted, we have seen that at the Department of Health level, there's an increasing emphasis on IYCF, on vitamin A supplementation and MNP supplementation. However, having said that, if I have 30 seconds left, I would like to mention that the same kind of interventions did come up during the federal level analysis as well. However, there is a large program that has been developed at the federal level, which does not incorporate the findings of the Optima analysis. And the reasons for that are multifactorial, and we can discuss that in the panel, but I think I'll stop here for now. Thank you very much.
Thank you very much, Leah. Next, we transition over. First, a reminder to put your questions in the chat, please. And next, we transition to a panel discussion moderated by Michelle Mehta, who is a nutrition specialist at the World Bank. And the panel is on the challenges and lessons learned. Michelle, over to you.
Hi, thank you so much, Cherise, and thank you so much to Ritkak, Mutriba, and Aliyah for those really great presentations. And I think we're all looking forward to hearing a little bit more from each of you in this panel discussion. So let's move on to it now. And I wanted to start first with Ritkak, and I'm going to give you 3 minutes to answer this question. And thank you so much for the presentation on stakeholder engagement. This is one very key element, of course. And this was, we got a really good overview from you on the process and where stakeholders were engaged. Can you elaborate a little bit more for us on what it means to have government or stakeholder buy-in to each step of the process, from undertaking the analysis to disseminating the results, and then finally to decision making. And you have 3 minutes. Thanks.
Thank you, Michelle. So I'll start by broadly articulating, I think for us, what we envisaged as stakeholder buying, which is really just a comprehension and an appreciation of the analysis that would bring stakeholders from perhaps a neutral or for some even an opposing position into a more supportive position. As we sort of deconstruct or stratify stakeholders, bringing some of those stakeholders into a leading position where they engaged with the analysis and led its sort of application to planning and to the budgeting cycle. For this, I think we stratified 3 groups of stakeholders, but falling within three groups of extremely, I would say, influential stakeholders. So these are the high influence, high power ones who fall within 2 big blocks: internally within government, where we have the political cadre and then the technical cadre, and then externally with development partners who contribute a significant proportion of financing to nutrition in country. As at the last resource tracking exercise, I think about up to 50 or 54%. One of the things I think that we envisaged for the political class was for them to be able to, at the point at which the data or analysis had been analyzed, to be able to engage with and appreciate that and translate it into the decisions, because the budget decisions finally are made by them. And I think the key thing for us here was to not completely de-link the sort of politics, if you might call it that, from the policy development process, but to be able to horizontally now at the leadership of the different MDAs that are involved, get them to understand the analysis and the potential outcomes, the financing needs, and then to increase their appetite to be able to use this for annual operational planning going forward.
You have about 30 seconds or so.
Okay. I think at the technical level, in terms of buy-in, this for us meant a cohort or pipeline of stakeholders, actors who actually would be able to conduct the analysis themselves, collect the data, routinely update as required, but also be able to, or to be able to facilitate with the technical assistance that was being provided by the bank and other development partners. And lastly, I think for development partners as an external stakeholder group to be able to be aligned with the planning from the side of government, have a harmonized position or key in, and have that sort of stakeholder confidence that the plans that were being developed were evidence-based and that they could put their financing and the technical assistance behind it. I'll stop here. Thank you.
Thank you, Ritkak. That was very, very interesting. And I think we're going to speed it up a little bit just because I want to get to the second round of questions as well. So I'm going to turn over to Mutriba from Tajikistan, and you gave us some great insights on some of those challenges. You referred to the creativity around data for the Optima tool. So we know that Optima tools require high quality data. So if you can just, in a very quick couple minutes, give us a little bit more insight on maybe some of those challenges on obtaining that level of data, but really more importantly, actually, how can countries be better prepared for the data needs for an Optima analysis? I think that piece would be very important to hear. Thank you, and over to you.
Thank you. So yeah, I'll try to be brief. In terms of challenges, so as I mentioned, we already, before starting Optima Nutrition analysis, we already knew that the data collection will be very challenging for Tajikistan because we don't have a nutrition, as I said, nutrition agenda has just started, and dialogue and policy was starting in Tajikistan. Thus, all the data is scattered around different reports, and also there is this mismatch of indicators. For example, what's been collected in the country in terms of nutrition indicators are very different from what's been collected around the globe for different types of data, plus, DHS has done after several years, so that to get the most recent data on nutrition was quite challenging, and different indicators were located at different sort of reports, and the costing was, as I said, was very, very challenging. So how the countries could be better prepared for the data. So as I mentioned, it's very important, the team that works on Optima Nutrition, conducting Optima Nutrition analysis in the country. First of all, they are at the sort of forefront of nutrition. We located the analysis within the SUN national platform. And the expert working group who were part of this, who were members of the expert working groups, they come from Ministry of Finance, they've come from statistical agency, and the whole work was led, but of course, SUN focal point, Madame Umar Zoda, who was first Deputy Minister of Health and Social Protection. So under her auspices, I think we were able, and she would enforce the data collection. She would actually get in touch with different agencies to say, well, you need to provide the data, you need to enable our data collectors, and then the quality of data collectors, not the quality, but I would say the technical.
Sorry, you've got 30 seconds left.
Sure. So the data collectors also were very well respected, well-known people, and very connected to the sort of nutrition and health sector, which enabled the sort of, to get the data very easily. Yes, thank you. There is more to say, but that's all for now.
I think there's always more to say, and I think this is a very critical piece of the tool, and some critical information that you're bringing up. So thank you, and we will have another round where we can talk a little bit more. And I want to turn now to our colleague from Pakistan, Aliyah, for your question, and if you could please elaborate on the rationale, the implications, and any important considerations in conducting an Optima analysis at the subnational or provincial level specifically. And you've got a couple minutes for your answer. Thank you.
The thing is, Michelle, 3 minutes are not enough to tell the story, right? But I'll try. So the thing is that the reason we opted for Sindh was because, as I said, we had a champion in Sindh, and it was because of the champion and because of the interest that the Planning and Development Department had in nutrition programming. Sindh is the first province amongst the 4 that we have this multi-sectoral package of interventions being implemented and now has come to a close, and there are very important lessons coming out from it. So I think it's important that at the Planning and Development Department level, you have that kind of focus, that laser focus on nutrition programming. As you know, Sindh has worse off indicators than Sub-Saharan Africa. And for us in Sindh, malnutrition is an emergency. It's a pandemic there, right? So I would go back to what Ridkak said earlier about having a nutrition division. I'd go back to Mutriba saying that we need to expand their nutrition vocabulary. So the thing is that if you're always going to keep nutrition on the sidelines in a wing or in a division, we won't be able to achieve the outcomes. Nutrition has to be mainstreamed in the PHC package, in the primary healthcare package. There has to be a prioritized set of interventions that we need to pick up and we need to deliver on at the PHC level, at the community level, and at the facility level. So just going back to why it was Sindh, it was because the government had requested us and because we were far ahead in terms of nutrition programming in Sindh than we were in the other provinces. I'm not happy. I would like to inform you that it has not happened in the other provinces up until now. We've not had a multi-sectoral program for Punjab or for Balochistan or for KPK. So Sindh, and the reason being, honestly, I've been working in this space for more than 20 years.
Leah, sorry, you have 30 seconds left.
Yeah, sorry. So I'm gonna speed up talking. So the thing is that unless and until you have champions in the government at the planning level, at the finance ministry level, I don't think we'll be able to increase the interest in nutrition programming, and nutrition programming has to be mainstreamed. And it has, and we've been able to do that to a certain extent in Sindh and in Balochistan. Thank you.
Thank you, Aliyah. Those are really, really important points. And you've all 3 of you have raised some some really critical points about implementing and undertaking Optima analyses and how can be used. So I want to go back to each of you for very quick 1 minute answer to one question for all of you to answer. And that is, given this week's theme of nutrition financing, what do you see as the key opportunities for the Optima tool? And how can we turn these analytics into programmatic and budgetary actions to improve nutrition? So again, a minute for each of you, and I'll go back to Ritkak first to answer that. Thank you.
Thank you, Michelle. I'll speak from the perspective of Nigeria in terms of key opportunities, and I started to touch upon that earlier. I think really now we have a national plan, but this is a federal state. The results really will come from subnational level if we are to make a dent on malnutrition. And so the key, I think, opportunity for us and the trajectory for Optima is to really take this down and do sort of what Pakistan is doing, take this down to states where we see that there is leadership, there's demand and appreciation for this type of analysis and for efficiency, and to be able to use this and try to institutionalize this into the annual operational planning processes. I think that really would be our priorities, and what is needed, like I said, the leadership, but we are trying to cultivate a pipeline also at subnational level of technical people who are familiar with the tool, who can conduct the analyses on a recurrent basis. And I would also say that a key thing that is required is to maintain, and we've all spoken about this, the expert working groups, which is diverse and which should be diverse and should have a range of stakeholders. Yes, we don't have the nutrition sensitive evidence or data yet, but I think, like Mira said earlier, this isn't a perfect tool, but it does provide some quantification and some benchmarks for planning and for budgeting. And I think that's what we are able to leverage. Lastly, I'd say the advocacy to translate this evidence finally into actual cash releases when allocations are made. Thank you.
Thank you, Ritkak. That was really great. And then over to Matriba for the same question on turning these analytics into programmatic and budgetary actions. Thank you. Just 1 minute.
Yes, thank you. I think for Tajikistan, one of the challenges was actually to get the Minister of Finance excited about nutrition. So Optima Nutrition tool provides actually an excellent document where the Minister of Finance can get excited about investment and how they can efficiently make their investments and allocate budgets for nutrition. I think it's one of these unique sort of analysis that can get Minister of Finances and local governments excited about investing in nutrition. And so I think it provides this for me. I always used to say this, our expert working group, that it's almost like in the puzzle is one of the jigsaws, important jigsaws that you actually could use in order to advance nutrition dialogue in the country. Also for us was very important, like it was very critical because at the time that the Optima Nutrition analysis findings were actually disclosed in the country had its own draft national multi-sectorial nutrition plan, and a lot of the findings of the Optima Nutrition actually validated interventions specified in the nutrition plan. So I think altogether, Sun Focal Point, Sun National Platform got very excited to get these results. And I think we need to work further on advancing this, on actually now working more closely with the Minister of Finance, GFF platform, other sort of coordination, collaboration, nutrition mechanism that we have in the country to get this work further advanced, I think. And hopefully our dream is that one day in the budget, in the state budget of Tajikistan, we will have a budget line called nutrition interventions. Thank you.
Thank you, Matriba. I hope that too. And now to Aliyah for this last question. Over to you. Thank you. Just about a minute.
This is a very complicated question, and a minute is then again not enough for answering that question. I won't repeat what Ritkak and Matriba has already said. They've made some excellent points, but I think as we go along, just the idea of conducting this exercise at the subnational level in itself is a huge achievement, because never before had the departments or the Bureau of Statistics indulged in this kind of an exercise, right? Like Mutriba said and Ridgak said also, getting that information, we do household surveys, but every household survey has different indicators in it. So actually to get all the data requirements fulfilled by the government was a huge achievement in itself, but it should not be a one-time activity. We've done, like, for example, for the project that I'm the task team leader for, we've done, my project has come to an end. So we've disseminated the findings of Optima. The secretary planning has been removed from her position and there is a new secretary planning. So the whole idea of, that momentum is kind of lost to a certain extent, right? With the secretary planning being shifted. So it's with the new secretary planning, you have to start that exercise all over again, saying this is what the government of Sindh did, right? This is how you achieved it. And these are the recommendations from this particular tool, which you need to take to finance and make sure that these prioritized set of interventions, let's say 3 or 4 interventions, which are very, very cost effective, need to be incorporated into the next planning cycle. But unfortunately, things are not that simple on the ground when you're working at the country level, right? So I'll just stop here because I can't say much more in 30 seconds, but then the idea is that this needs to be done again and again. You need to go back to the government again and again and say that, this is an analysis that was done. These are the cost-effective measures. These are the 3 scenarios that you have, and you need to make sure that in the next planning cycle, these are incorporated. But that requires a lot of hard work at the country level. And with the bureaucracy changing, with technical people changing, it becomes very, very challenging. I'll stop here. Thanks, Michelle.
Thank you, Aliyah, and thank you all 3 of you. I think, apologies that we've had to speed up a little bit, but I wanted to get the Q&A session going as well. But I want to say also thank you for touching on the really critical and important points on Optima. And again, we could have a longer conversation on this. But I'm going to turn it over now to Mira for the Q&A session, and she's going to field some of the questions that have come through the chat. Over to you, Mira. Thanks.
Thank you. Thank you very much, Michelle, and thank you to all the presenters. It's been fabulous hearing from all of you. And I just want to emphasize a few things that you all said in the panel just now. The fact that you need champions in government. This is helpful. This is a tool that will give you some numbers. It's basically an analysis, but if nobody is there to buy the results, then it doesn't translate into policy. So that's really important. And that links to the political commitment issues that Aliyah was mentioning, Rika was mentioning, and Mutriba has mentioned as well. But at the same time, also useful to think that this is a way to bring in more interest from the Ministry of Finance, who ultimately is responsible for financing. So with that, let's turn to some of the questions that have been posed by all of you. I'm going to put some of the questions together so that we have time for discussion on several of the questions. So let's get to the first question. And Jonathan, I'm going to send these questions, a couple of questions all rolled together to you. There were several questions about whether the tool can give us, can give results on a combination of objectives. So some of the examples focused on stunting alone, but if a country, which is in real life, wants to think about multiple priorities at the same time, can this tool help? And perhaps linked to that is the question around data and costs. Given that costs can be different in different countries, how do you address that? So over to you, Jonathan.
Thank you, Mira. Thanks for these excellent questions. So on the first question of whether or not you can combine multiple outcomes as an objective. So the tool does have several nutrition-related outcomes on stunting, wasting, anemia, and nutrition-related mortality. And in cases in which is mostly the case for a lot of national nutrition strategies and plans, the interest is not only in one outcome, but in multiple outcomes, achieving reductions in anemia, achieving reductions in stunting and wasting, and so on and so forth. The tool can accommodate these multiple objectives. So you can actually run an analysis and say, my outcome objective is really, I want to reduce both stunting and anemia. What are the sets of interventions within this budget envelope that can help me achieve the greatest outcomes in those areas? And there are ways to model that. The tool is able to do that and to think about how you set those objectives, because averting one case of anemia is much different than averting a case of stunting. So there's some negotiation and deliberation around how to then prioritize those two different outcomes in an analysis. On the question of cost, so from country to country, costs are going to vary because there are different platforms, different costs of labor and resources. But also, I know there's also a question around understanding, the reliability and quality of the costing data, how to ensure that you're not only taking, perhaps the cost for a certain intervention at a certain level of coverage is going to be very different than the cost for that same intervention when coverage might be higher or lower. So in terms of quality and reliability, I think it's really important that the costing process, there's transparency for one, but also the guidance and the expertise of the technical working group and the staff, maybe consultants that are engaged in developing these costing estimates. That those it's important that there's high quality amongst those and there's clear support from the technical working group. The tool can actually account for changes and assumptions of changing unit costs for the intervention, the marginal cost for the interventions. So you can indicate in the tool that you have marginal costs that may increase after a certain coverage level, and the tool can account for that. And likewise, you can have an intervention where the marginal cost might decrease as coverage increases, and that can also be accounted for. Over.
Great, thank you very much, Jonathan. And just to add to that, we are collectively pulling together a website for Optima Nutrition, and some of the answers that you folks are looking for, perhaps one of you can post it in the chat, are there as well. And cost data are attempting to be collected at country level as well, so that we can use as local data as possible. So let me now move to a next question, and this is primarily for Ritka and Aliyah. If you can talk about the fact that the current focus of the tool, as many of you have seen, is really on the nutrition-specific interventions. Have you had a chance to look at the or add in the nutrition-sensitive interventions, and what has been your experience with that? So Aliyah, let's start with you first, and then we can move to Ritka.
Thanks, Mira. At the time of the analysis, I think we focused more on the nutrition-specific interventions because that was the information that was available. But like I said earlier and presented in one of the slides, I think it's time now that with the closure of the project through which we were able to do all of this, I think it's time that because of the COVID-19 emergency over the last 2 years, a lot of funds have been diverted towards the COVID-19 emergency, right? So I think this is an opportune time where we need to maybe run the Optima analysis once more for the government of Sindh, so that we can actually see, what was true back in 2019, is that still valid or not, so that we can inform them effectively and they can then take that forward in their next cycle of planning. I'll stop here. Thank you.
Thank you, Aliyah. If I remember correctly from the analysis, didn't Pakistan include conditional cash transfers as well as a nutrition sensitive thing? So maybe you can say something about that?
At the federal level, yes. And I'd look towards Jonathan for the Sindh analysis, because at that point in time in Sindh, we had not actually started the pilot CCT, which was under the project. But at the federal level, we did. Jonathan, would you like to comment over here?
Sure, thanks, Aliyah. And I think in general, so in terms of Pakistan itself, yes, so part of the analysis, well, and one of the key aims of the analysis was actually to inform a social protection project and to decide how best to target the poorest population and which interventions to use. So in that sense, there is some engagement on the nutrition sensitive side. The challenge for Optima is that there's a lot of evidence on nutrition specific interventions in terms of impact, the pathways, and the potential outcomes. But for nutrition sensitive, it's an emerging field of evidence that there's some work ongoing, particularly around nutrition sensitive agriculture, that once that becomes a bit more developed and their actual quantified impact from a particular intervention to the nutrition related outcome, then we can include that in a model, which is it's a deterministic mathematical model. So that it needs that kind of level of information, quantified impact, which a lot of the nutrition sensitive interventions currently do not have. Over.
Thank you. Thank you, Jonathan. So Ritkak and Mutriba, would you both like to comment on the nutrition and the issue of nutrition sensitive interventions?
Sure, thank you. Thank you, Mira. I'm not sure I have much different from the experience in Pakistan. In Nigeria, we did focus also on the nutrition specific interventions because like Jonathan said, there is a paucity of data for us locally. Also on nutrition sensitive interventions. We are now conducting a national food consumption and micronutrient survey after 2 decades. So we hope that that will emerge some new data and will also give us an indication of indicators that we can continue to track in other surveys going forward, which the National Bureau of Statistics will be conducting. But also we look to the global framing and to the global evidence around nutrition-specific interventions as it becomes available. But for now, we focused mainly on nutrition-specific interventions.
Great, thank you very much, Ritkak. Before I go to Mutriba, just a reminder, other questions, please feel free to continue to post in the chat. So over to you, Mutriba. Thank you.
Thank you. So at the time that Optima Nutrition analysis was done in Tajikistan, I think this may be a function of incorporation of nutrition sensitive interventions did not exist, so we did not collect that data, and I think Pash we would run to the problem again, because the same with what Ritkak said and Aliyah said, this data did not exist. Now, as a national multi-sectorial nutrition plan has been adopted by the government of Tajikistan, it's been launched since last year. I think there is an opportunity for us to maybe run reinitiate Optima Nutrition analysis again, maybe after a few years, and see the results with incorporation of nutrition sensitive interventions as well.
Great, thank you very much, Mutriba. So while we are waiting for more questions, I'm going to try and respond to one question that came from somebody on Côte d'Ivoire. And you were asking how much resources Côte d'Ivoire has gotten and whether they have been able to allocate those resources. Côte d'Ivoire did do an Optima analysis as well. And I'm going to request Chiara to share the results from Côte d'Ivoire. They've actually done an incredible job in terms of both allocating resources, but also in getting results. If I remember the numbers correctly, their malnutrition stunting rates have gone down from about 30% to, remind me, Chiara, 22%, 21%, somewhere there.
Yes, 21%.
21%. So that is a good example of a country that has used these analyses and gotten to where they want to get. So let's move on to other questions. There's a very interesting question from somebody saying, how do we ensure that we get inputs from frontline workers who are involved in data generation and service delivery? Who wants to take that question? Aliyah, Jonathan, Ritka, Mutriba, who wants to go first? Okay, go for it, Jonathan.
I can go, sure. Thanks for that question. So I think there's some parts of the process that I think frontline workers the input from frontline workers would be valuable, and that really is around the costing of these interventions, and well, one, the costing, but also understanding the delivery of these interventions to do a proper costing of it as well. So I think depending on the context, understanding, depending on the context, whether there's available data on the cost of the interventions, you might need to engage in this sort of ground-up costing exercise that will need to then involve frontline workers. I think in the overall engagement, it's not a lot of the engagement at a high level, given that the key aim is really to inform decision makers and policy makers in using the results. Over.
Great, thank you very much, Jonathan. Do any one of the others want to add something? Aliyah, Ritka, Mutriba?
I would like to, Mira.
Go for it, Aliyah, all yours.
I think given the experience that we've had in Pakistan, frontline workers are basically not involved in this discussion. And I think they should be involved in this discussion. But ideally speaking, we've had 2 rounds of it, one at the federal and the other at the provincial level. And we've not basically had much inputs from the frontline workers. Firstly, because of the fact that they're not invited to these fora, to these trainings, which I think we should, because at the end of the day, we want to know what percentage of their time is being dedicated for delivering on nutrition-related interventions, right? And reading it from reports is one thing, but having a one-on-one candid chat with the frontline workers, with the healthcare service delivery providers at the community and facility level is another thing altogether. And it's also for their understanding. So I think whenever we do the next round of Optima, this is a great suggestion, and we should involve them or have a separate session for them or something to that effect. Thank you.
Excellent. Thank you very much, Aliyah. I am going to move on to the next couple of questions. We are pretty much coming to the end of the question and answer round. There have been a series of questions around bringing together other partners into this conversation. And though the question is more at the global level, I want to hear from, say, let's start with Ritka on the country level. Did you bring together other partners into this conversation and including in getting data from the country level? So Ritka and then Mutriba.
Thank you, Mira. Indeed, we did bring in other partners at multiple levels. I think first, the expert working group, which I mentioned. So we had a number of partners involved from UNICEF to Bill and Melinda Gates Foundation, all locally present international NGOs, and different development partners who finance or implement nutrition interventions in country. I'd say the Bill and Melinda Gates Foundation was specifically very supportive of the stakeholder engagement and familiarization process and orienting the teams on what Optima could do and really helping us sort of get through into the door with government. But I think also one of the key things around development partners was then when we moved towards a multi-sectoral plan of action, that we saw the sort of coalition of all development partners under the Sun Network be able to come together and sort of demand or request the bank's support for this analysis and for it to be applied to, one, it helped shape the Nutrition for Growth commitments, but now we're talking about annual operational plans for the government. And I think that the stakeholders are looking to see how they themselves can key into that analysis based on the priority interventions that have come up as a result of the analysis. In terms of data collection, not specifically, but most of these stakeholders are involved in the surveys. from the Food Consumption Survey to the Living Standards Survey to GHS, which all collect different bits of information outside of the traditional sort of health sector surveys. So we do sort of all get coalesce around that as well.
Great, thank you very much, Ritka. I'm going to turn it over to Mutriba with an added question linked to data. Did you have to do primary data collection, or were you able to access data, existing data? And with that, we're going to try and wrap up very soon. Over to you, Mutriba.
Sure, thank you, Media. So we did collect secondary level data. It means that we looked into reports and we did not directly collect the data, even though going back to this engaging sort of frontline workers, health workers, we did actually had to go, our data collectors had to go and conduct some interviews to ask, for example, how much time they spent on nutrition counseling, and then trying to then kind of break down their salary into those minutes that they spent basically on nutrition counseling in order to calculate the services of nutrition counseling and how much it costs. So, and then in terms of engaging development partners, they were engaged at different stages. We were the first presented the idea of doing Optima Nutrition analysis in Tajikistan. We invited, we have, as I said, the national SUN national platform and members of, so we have SUN donor co-conveners, and we have also very active nutrition development partners. All of them were invited, and we heard them, we consulted with them, and at various levels we have consultations when, you know, the data on the national level and sub-national level was analyzed. We presented them the preliminary findings, consulted with them, they commented on the results, and also they were very much looking forward to the findings because they wanted to see whether what they were doing actually was efficient, and what else they can learn from this Optima Nutrition analysis, how they can better make decisions about their budget allocations and nutrition programming. So it was very good. It actually brought us all together to learn more. It was very much sort of capacity building for the country, for the sort of domestic and international sort of actors in nutrition, and it was very interesting process that we went through and did a lot of learning, a lot of arguing, but then a lot of coming into conclusions. So altogether it was very interesting experience for us, and maybe we had this learning curve of teaching each other about things that we knew, but also they helped us also in terms of data collection. For example, UNICEF provided the inputs, comments on the findings, as well as they provided data on cost of services. Thank you.
Excellent. Thank you very much, Mutriba. So with that, we're going to wrap up the question and answer sessions. And I just want to add one question that was asked by somebody about collaborating at the global level, and we certainly are trying to do that. Jonathan mentioned the technical advisory group that we pulled together, and many of the institutions and organizations that are here today are actually part of that tag as well. And if there's some other group that wants to be a part of that, you're most welcome to join us. And we also really appreciate the inputs that have been received, as Mutriba said, from partners like UNICEF and others that have helped to provide the data. And we saw that happen in Pakistan. We saw that certainly in Nigeria as well. And really the effort over time is really to make sure that we all collectively stand behind the country teams as they do this work at the country level. Some of you were asking what the outputs look like. I think Aliyah shared some of the outputs from the Sindh experience. And really the outputs essentially said, you know, if you put a lot of money into, in the case of Pakistan, the supplementary nutrition food, maybe reallocating some of that to vitamin A supplementation will give you a bigger bang for the buck, which really was the kinds of outputs. But there are additional outputs that each of the country have created as well. And again, reminding everybody, there is no one size fits all. There is it needs to be done in the country context, and the allocations need to be made and at the country level. So with that, I'm going to try and share with you some ideas around the way forward. Do we have a slide after this? I can't remember if we have a slide or not, but I would just like to speak to the issues. So first and foremost, in terms of going forward, first to remind everyone that we're working with the Bill and Melinda Gates Foundation, with whom we started this effort in the first place. But many of you are part of the TAG. We hope to continue that those partnerships as we move forward. We will be constantly updating the tool with new data and evidence that becomes available, particularly in partnership with the LIST team at Johns Hopkins that is doing the data updates and working very closely with the Burnett Institute in Australia that has been helping with some of the analyses as well. As we do this updating of the tools, we really also want to get feedback, the kinds of feedback you've given us today, for example. We will take that on board as well and include that in the updating of the tool too. As many of you know, we've been working with in many of the countries to do trainings for country level partners as well. And our longer term, I would say medium to longer term objective is really that these analyses are done by the countries, for the countries, with the countries. You know, the sort of things that Aliyah, you described happening in Pakistan, in both at the federal level and at the subnational level. When that, and same thing, Ritka and Mutriba as well. When these analyses are done by in-country teams, then you can argue about them, you can discuss the results, you can disagree. I do remember at the federal level in Pakistan some very heated discussions at some point, but ultimately the outcomes are then owned by the countries, and that's really what we are aiming for in the longer term. Each country must own the outcomes. You can put in your own country data, and several of you talked about how important that is to have local data, both on the epidemiology, but also on costs and impacts as well. So that will be our medium to longer term objective as well. Continue the training, continue the dissemination. We heard from you in the poll that you want to hear more about this, that you want more TA on that, and all of that is something that is very much part of the plan. We will constantly provide TA from here, but we will depend on each country to then take the lead themselves so that the outcomes are owned by yourselves. Then there are some areas that are gaps in the tool at the moment. So that's again something we will work on. Several of you mentioned in the question and answer, but also in the chat about nutrition sensitive interventions. As Jonathan said, we would love to include all the nutrition sensitive interventions. The challenge is we do not necessarily have all the cost and the impact data. And this is a tool that does require those things. As more data become available on the nutrition sensitive side, particularly we are seeing more data on cash transfers. As those become available, we will add those in. There are new data emerging on the agriculture side as well. We will include those as well. If we miss anything, please remind us. And lastly, we are also planning to update the investment framework that you had seen earlier in 2017. There is a preliminary update on those numbers in the Global Nutrition Report in Chapter 3, the financing chapter. But the plan is that in this 2022, we will be updating the investment framework as well. One of you asked if Optima Nutrition has led to increases in allocations at the country level. That is really not the objective of Optima Nutrition. The objective of Optima is really to get more nutrition out of the money, not necessarily more money out of nutrition. But if we can get more nutrition, if we can get more impact, you get success. And if that happens, you do ultimately get more resources as well. So let me close now with a big thank you to all of you who've joined us today. All of the panelists who've been here today, the partners from the Gates Foundation who unfortunately were not able to attend, but stand behind us strongly. The Optima TAG team, the technical advisory group, very, very helpful inputs from them. The Burnett Institute, who've been our partners in crime from the very beginning on this one, starting with the actual Optima HIV, and then the LIST team at Johns Hopkins, who have been very, very critical partners in terms of helping us update the evidence. And of course, I really want to thank our own internal, the World Bank Optima team, who've been working very, very hard. I won't name anyone on any of those, but you all know exactly who you are, both at the country levels, but also at the global levels. You've done an incredible job. We hope to continue this. And before we finish, I want to thank the TRG team that has facilitated this session, and we finished almost on time. I took 1 minute longer than I was supposed to. Apologies for that. Thank you all very much again. And don't forget to join us again tomorrow for the last day of the Nutrition Financing Week. Lots more interesting sessions. Thank you.
Thank you.
Thanks, everyone. Bye-bye.
Thank you.
Thank you.
Bye-bye.
Thank you, everyone. Stay safe. Thanks for the opportunity. Bye-bye.